There's one, there'll be like one kind of interesting background at the end. It'll be like,
He's the communications director.
Working people.
Oh, that's so exciting.
Around campus, and I remember when
Oh, whoops.
Yeah.
you didn't know the funny name, did you?
No.
Oh, it's okay, it's not power, but
I just put it on the song.
would have to
That Tyler
It feels like it. It just shows you how
or the highlight. Great. All right. Yep, sorry.
Check out the sunrise, they look like No, it just, it works there, we try to line it up here. You know, if I edit this part, this is a big now where we need to go. Yeah, so we step up to the mic.
Yeah, you should be getting nothing.
Good afternoon, everyone. Thank you for being here today. On my right is Dr. Kara Christ. She leads the Department of Health Services for the state of Arizona, and On my left is Major General Mick McGuire. He's leading up both the DEMA effort and our National Guard. The focus for the last several weeks has been that we stay healthy, return smarter, and return stronger. I want to give you an update on where Arizona is today and what it looks like going forward. I want to begin by saying thank you again to everyone. We've had some very good results. Our plan is working. We're proceeding with caution, and that's because of the responsible behavior we've had from the people of Arizona. You can see common sense all around us, and I'm very grateful. I know that there's been a lot that's been asked. There's been a lot of sacrifice that's been given, but we're starting to see some positive results. The objective here is to return stronger. We want to reinvigorate our economy in the state of Arizona. A little over a week ago, we gave the opportunity for our restaurants and retail to reopen along with our gyms. And what I have seen has been that Arizonans have been mostly calm with this new opening of our economy. And you don't have to take it from me. Take it from the Arizona Republic. It's mostly calm out there as Arizona reopens. So again, I want to extend my gratitude to our citizens who are returning safely into economic participation. And there's different retailers and business leaders that have been reaching out to us. Of course, we're reaching out to them. They've given us hundreds of comments. They appreciate the opportunity to get people back to work. Cleanliness and sanitation have been a priority. And of course, everyone is looking forward to the return of visitors and clients and are prioritizing the safety of their guests. Everyone's following the Centers for Disease Control, and we're asking them to continue to follow that guidance. And retailers and petroleum marketers and food marketing alliances are all working together to share best practices. And that's a very positive sign. I also want to say that Arizonans have been generous during this time of downturn. $8.2 million donated to the Arizona Coronavirus Relief Fund. You can go to ArizonaTogether.org if you need resources, ArizonaTogether.org if you want to donate resources. Our first contribution came from Michael Bidwell and the Arizona Cardinals of over $1 million. The Ivy Foundation was a major contributor. Of course, APS and SRP, Jerry Sims, Mountainside Fitness, Southwest Gas, and DeAndre Hopkins. It's been 400 individuals and entities in Arizona that have contributed to this fund. This fund is going to important work like helping foster families and foster children, the homebound, the medically fragile, and of course people that have special needs. So again, thank you, and if you want more information, ArizonaTogether.org. We're also focused on our child enrichment centers. We realize that as Arizona's return to work and our schools closed, we want to have child care resources available for our families. To date, 426 child care providers have registered. These are in 52 cities around the state. Over 3,300 families have been benefited from this, and 2,300 plus families have qualified. This will be extended through July of this year. I also want to say we're focused on our local communities. There have been dollars that have been coming from the federal government to the state of Arizona. We want to get these dollars out to our local communities. We've been listening to our legislature. We've been listening to local mayors and county supervisors. These are dollars at this time, to the best of our knowledge, we'll be able to distribute once. So we want to distribute them responsibly with the most impact to benefit our citizens. We've gotten a lot of input from not only the legislature, but mayors and supervisors. We want these dollars to go out with a sense of urgency, but we wanted our decisions to be informed, and we want to give the maximum amount of flexibility to our local leaders who really know what's the best decision inside their municipality. Our approach is going to remain calm and steady. We're going to have a sense of urgency to protect public health. In Arizona, our economic decisions have been on later timing because we simply were not hit like we saw on the eastern seaboard. We've had a lighter touch in these restrictions on our economy, and now we're seeing that coming back. But every decision we make will be informed with data. This is the White House gating criteria. It's the information that's been informed by the CDC. It's how we've made our decisions around symptoms, cases, and hospitals. It's the guidance that's been given to every governor around the country. You have flexibility whether you want to work statewide or county by county. We've been able to work statewide in the state of Arizona, and I want to give you the specific statistics on where we are in Arizona today. On symptoms, you want to see a downward trajectory of influenza-like illnesses reported within a 14-day period, and the same trajectory with COVID-like cases in a 14-day period. This is what Arizona looks like since December 29th. If you direct your eyes to the vertical line, that's when the stay home, stay healthy, stay connected order was issued. The blue line is COVID-like illness, and the gold line is influenza-like illness. You can see a downward trajectory over the last 5 weeks in both influenza-like illness and COVID-like illness. That's good. That's the direction that we want. And in terms of the White House gating criteria, that checks the box on symptoms. Next is cases. You want to see a downward trajectory of documented cases within a 14-day period, or a downward trajectory of positive cases as a percent of total tests within a 14-day period. Where's Arizona? This is our COVID-19 cases by day. You see a lot of information and data here. We are having more testing. We've been ramping up testing with testing blitzes the last 3 weeks. With more testing, you're going to see more cases, and this information doesn't give us the information to make a decision on that stage gate. This information does. The blue represents the amount of testing that has happened in Arizona, and the gold line represents the amount of contraction of COVID-19 to our citizens who have been tested. If you take a look, you see 5 consecutive weeks beginning April 5th from a high of 10.7% contraction of COVID-19 to tested citizens, down to 9.6, down to 7, down to 5.5, then 5.3, and this last week you see a 3% contraction. Again, that's the right direction, and that checks the box for the White House gating criteria in terms of cases. Now let's talk hospitals. Hospitals are what you want to have so you can treat all your patients without crisis care. This has been the major concern around the country as there was an anticipated spike in COVID-19 illnesses. In Arizona specifically, our hospital bed situation remains positive. Gray represents beds available. Blue represents beds in use, and gold represents COVID-19 patients. As you can see, this has remained steady across the course of time, and our COVID-19 patients have remained somewhat flat around 10% of available hospital beds. This says that Arizona is prepared and has capacity should we need it. If you get very sick, you need an intensive care unit hospital bed. Again, gray represents available ICU beds. Blue is beds in use, and gold is COVID-19 beds with those patients. We've hovered at about 20% or below over the last several weeks. We have capacity. We are prepared if there were to be a spike. Ventilators. We have a lot of ventilators available. That's in gray. Very few ventilators in use, and even less for our COVID-19 patients. So the takeaway here is we have ventilators, hospital beds, and ICU capacity. Arizona is prepared. Now testing. The White House and CDC want to see a robust testing program in place for at-risk healthcare workers, including emerging antibody testing. That's testing that tells you if you've contracted COVID-19 and have since recovered. And we want to, of course, trace contacts of COVID-19 results. We've had a testing blitz. You can see it was announced on 4/27. Over 220,000 total tests have been conducted, along with 59,000 antibody tests, along with the diagnostic test. That blitz will continue into the foreseeable future. We have focused our testing on frontline workers, doctors, nurses, emergency medical providers, people that believe they've been exposed to COVID-19, and people that believe that they have COVID-19. Our hospitals and testing checks the box for the White House gating criteria. So before we get to Dr. Christ, I want to say that this gives us the information not only for the decisions that we've made last week, but the decisions that we'll make this week. It also gives us a focus as to where Arizona is most vulnerable, and that's in our long-term care facilities, assisted living facilities, congregate care, state prisons. It's places where we still have large groups of people together, and Dr. Christ is going to take you through our plan going forward. Dr. Christ?
Thank you, Governor. So the first project that we're working on is skilled nursing facility testing. So these are our Medicare certified skilled nursing facilities. There's 147 of them statewide. So we discussed this last week as we were talking about what we were going to do to protect those vulnerable adults in this congregate setting. We started our first long-term care facility testing last Friday on May 15th. We continue to do that. We're working with a contractor that's going out to the facilities. We can do up to 12 facilities per day, and so we're working to meet that 2-week requirement. We are doing PCR on residents and serology and PCR on staff. In addition, we'll be providing the facilities with the test results, providing them technical assistance on infection control guidance that's tailored to their specific facility and their specific situation. We're providing them with personal protective equipment, or PPE, so that if they do have positives that we identify, they can adequately control transmission of that disease. We are also providing assistance with staffing to get people in there just in case we've got staff that test positive and need to be removed from the workplace. And then we are also working on a plan to, if requested by the facility, to provide terminal cleaning. So a final clean, and then they can move on. The other thing that we're doing is we have reached out and done phone infection control technical assistance, and so we have reached out to 100% of those 147 skilled nursing facilities where we've walked through the CMS infection control guidelines and requirements. Our goal now is to be on site at every single skilled nursing facility to complete that infection control survey by June 5th. And so all 100% of our skilled nursing facilities will have a survey by then. Now, not all long-term care facilities are Medicare certified. So we have assisted living facilities in Arizona that are not Medicare certified. They are state licensed. So as soon as we have gotten through the skilled nursing facilities, we will begin to test in our residential facilities. So these will be assisted living facilities or centers. Those are facilities that have 11 or more residents living at them. And then assisted living homes, which is the majority of our assisted living facilities. And those have 10 or less residents. So we'll be working with them. But again, we have reached out to 100% of our assisted living facilities to provide technical assistance on infection control, to make sure that they understand how the executive orders apply to them, and then to provide any technical assistance that they may need. And then we are also working to do focused infection control surveys at assisted living centers that have identified issues. Another vulnerable population is our correctional population, and so we continue to partner with the Arizona Department of Corrections, Rehabilitation, and Reentry, and we are working to expand testing capacity for our inmates and correctional officers. So currently we provide testing for all symptomatic correction officers and then inmates with COVID-like symptoms. So moving forward, we are partnering with the University of Arizona to offer antibody testing of all correctional officers. Initially, that was just going to be for the 9,000 state correctional officers that we have. But as we were reviewing, what we identified was that a lot of the contractors that the Department of Correction uses do come into contact with correction with the inmates. So we are expanding the antibody testing to include all healthcare workers, first responders, correctional officers, and the contractors at our prisons statewide. So that'll be about 16,000 correctional officers and contractors. We're working with the U of A. They have sites that are set up statewide where the correctional officers and the contractors, we will provide the transportation to go there. There are a couple of facilities that are very rural, so we will be working with those prisons to send our contractors out, our blood draw contractors out to go draw the specimens at those facilities to make it easier for those individuals that work there. We're also working on contact investigations. So this would be if there was an identified COVID case in a prison, we would then work with the prison to do testing of any of the inmates or workers that come into contact with that individual so that we can do an epidemiological investigation and make recommendations. We are also working to provide on-site technical assistance with infection control at the prisons, and are working with the prisons to do that at all of the locations statewide. Thank you, Governor.
Thank you. If Arizona has had a hot spot or area of extreme concern, it's been the Navajo Nation. We have worked overtime to help the Navajo people and all of our tribal nations, but Navajo has been hit especially hard. I want to thank Major General Mick McGuire for the effort that he has put in with the National Guard and our medical resources to get needed supplies and personnel to the reservation. Will you give us an update on what's going on Navajo, please, General McGuire?
Yes, sir. As many of you know, as the governor mentioned, the Navajo Nation has been a hotspot and an area of high infection per capita throughout not just Arizona, but the entire nation. On March 28th of this year was the first time we were contacted through Dr. Chris' team at the Emergency Operations Center about a need for resources. Since March 28th, and subsequent to the governor authorizing the activation of the National Guard, we've formed into 3 specific task forces: Task Force Aviation, Task Force Medical, and Task Force Logistics. And on that initial mission, we were able to go out with Black Hawk helicopter and a team to triage incident at Tuba City Medical Center. Additionally, we brought emergent requests for PPE by air out to that location, and since then, we've been able to work with Dr. Chris' team to deliver 31 pallets of direct assistance of PPE directly to the Navajo Nation. as well as 80 ventilators provided by our federal partners through FEMA over the last 2 months. Additionally, beyond the efforts that were made in the PPE area, we continue to have 2 aircraft dedicated on standby for 24-hour alert to fly up to help move people around through the surge line or deliver assets. We've incorporated medical training criteria that we're doing at all of the facilities, as well as Emergency Operations Center and public health institutions on the nation to talk about how to utilize PPE and better conserve to meet the requirements as they continue to battle COVID-19. Our medical team also has the capability to do that testing, and one of the areas of intersection between the Aviation Task Force and the Medical Task Force was just last week. We were asked to fly a team out to test all 75 workers in the Navajo Nation Emergency Operations Center and other incident command teams. Finally, I would say that we have a very limited amount of medics in the Guard, but what we try to use those medics and dedicated personnel for is to triage while we come up with permanent staffing solutions. We were able to do that both at Chinle, for Arizona Guard, and the New Mexico National Guard at Shiprock, creating up to 100 additional beds. We're providing 12 permanent staff up there, split between medics and logistics support staff, as well as the folks that are operating in the Emergency Operations Center in Navajo County, as well as assigned to the Navajo Nation Incident Command System. And finally, beyond all that, as you've heard me say before, one of the things we talk about in the Guard is always ready, always there. We have worked hard to help triage the need for food, ice, water, and medical supplies throughout the nation, including the delivery to 4 of the chapter houses of 5,000 gallons of potable water that helps with the cleanliness, sanitation, and obviously health and sustainment of those communities. And we stand ready, sir, to continue to help them with all of the support we're receiving from donor groups, as well as our federal partners and other state agencies.
Thanks very much, General McGuire, and thanks to the brave women and men in the National Guard for their effort to support Navajo Nation. Let's talk about where Arizona is today. Arizona continues in the right direction. We have a downward trajectory of influenza and COVID-like illness. We have a downward trajectory of positive tests, and we can treat all patients without crisis care. Our expanded testing availability, including antibody testing and contact tracing, mean that we continue to have a green light. Now, this is a green light to proceed, not a green light to speed, but we are proceeding. Last week, when we visited, I said to you we were entering Phase 1 and that we were safely and squarely in Phase 1. Today, we remain safely and squarely in Phase 1. We want to say that what you're doing, what the people of Arizona are doing is working. We have slowed the spread of COVID-19. We have hospital capacity. We're ramping up the testing blitz. We're seeing the symptoms dropping, and businesses can continue to open. We want to continue to practice social distancing. That's what's going to be important going forward so we can continue to return smarter and return stronger. We are aspirational for what's possible, and we are thinking ahead of what is next. Our goal is we want to open up summer camps, schools, and youth activities. So we are planning ahead, and all the evidence that we've seen over the last 4 or 5 weeks say that it is responsible and prudent to plan ahead for schools, summer camps, and youth activities. So we're working with the education community, school leaders, on a plan to safely resume school in the fall. We're going to return the Arizona way. It's going to continue to be gradual and phased in. We're going to balance and prioritize public health and returning stronger. We're going to increase testing to return in May while maintaining physical distancing. So this idea of physical distancing, staying 6 feet away, is important that we continue that. And lastly, we're going to have a phase-in return based on the recommendations of the CDC and health experts and guided by public health as we continue moving forward. Now, we talked a bit last week and the week before about returning stronger in our economy and turning the dial on the light switch to bring back the energy which Arizona's economy had just 12 weeks ago. There were people, and are people, who were displaced. Over the last several weeks, over $777 million has been dispersed in unemployment benefits to the nearly 500,000 plus hardworking Arizonans that were doing great 12 weeks ago and suddenly found themselves without a job. We realize the stress that's been on the Department of Economic Safety. Economic Security. I want to say thank you to Tom Betlak, to all the hardworking employees that are there, the new employees that have come on board so that they can answer these claims. We're starting to see these claims go in the other direction, but we want to make certain that everyone that needs their unemployment insurance benefits can get their unemployment insurance benefits. In addition, pandemic unemployment assistance. This is certain benefits for individuals that would not otherwise be eligible for unemployment insurance. Over $355 million plus was distributed last week to over 165 Arizonans. These payments will be retroactive to the date of eligibility back to the week of February 2nd, 2020. The DES call center will be open to assist on Sunday and Monday, which is Memorial Day, between 9:30 and 5 p.m. If you take this $355 million in benefits and the $777 million, it's over $1.1 billion in assistance that's gone out in just the last several weeks. Now, I want direct your eyes, please, to the screen for those that are re-entering the workforce that need help, assistance, training, and education as to how the state and the Commerce Authority can assist you.
Change. Change leads to opportunity, and opportunity opens doors. Arizona at Work is connecting job seekers with local resources, helping you explore career pathways, access free training, obtain new certifications, and find a job. Together, our network can help you return stronger. Find training programs for new career opportunities at azcommerce.com/returnstronger.
I want to thank Sandra Watson and all the hardworking people at the Arizona Commerce Authority. They've been working closely with our business leaders, entrepreneurs, and innovators. I know that this has been a challenging 12 weeks. There are going to be opportunities, and there are opportunities opening, and the Commerce Authority in the state of Arizona wants to help. So whether it's career planning, training programs, or industry certificates, folks that need reskilling and upskilling, we've got an initiative at the Commerce Authority. You can find out more at Arizona at Work or visit azcommerce.com/returnstronger. So if you're looking for a headline, I think what I'd say is that the AZ plan, that Arizona's plan is working, and we are going to proceed with caution. And with that, we'll open it up for questions. Patrick?
Let's start over there with Billy. Thank you, Governor. Billy Hartpot, iHeartRadio.
Los Angeles Mayor Garcetti still has very strong, strict regulations in place, and a lot of people are talking about leaving Los Angeles, leaving California, and moving to Arizona, as well as bringing businesses from California to Arizona. What is your message to the people of California that are considering that move?
Well, the first thing I would like to say is, of course, I want to have a certain amount of respect for other elected leaders and the decisions that they need to make. Our focus has been on protecting public health and safety. We've had to make difficult decisions in the state of Arizona. I want to thank the people of Arizona for their cooperation, partnership, and leadership in doing that. Our situation in Arizona is different than what's happening in California. Arizona's been no stranger to people from California for years that have been moving to our state for a more business-friendly environment, for more opportunity, for more value. Arizona was the fastest-growing state in the nation, or among the fastest-growing states in the nation. Maricopa County was the fastest-growing county in the nation 3 years running. So I'm certain that Californians are continuing to look at Arizona, along with folks from all over the country. I guess I'd like to say to anyone that's looking to Arizona, that's coming from a place like California, just to remember that you leave California for a reason. And in Arizona, we've had common sense policies, and we've had a lighter touch from the government here, and we've encouraged not only public health, but free enterprise along the way. Thanks, Billy.
Howie? Hi, Governor. I'll remove the mask temporarily. I do have a spare one for you if you're ever interested.
I have plenty. Thank you, Howie.
Two questions. One really simple. The legislature is considering a measure to basically defang your provisions in Title 26 to levy misdemeanor penalties for violations of your order and replace it with a $100 fine. What's your thoughts on that?
Howie, you know my policy. I do not comment on legislation as it's moving. I respect the legislature as a co-equal branch.
Okay. Now, the other question may be a little harder for you to... Anyway, as you know, the president announced he is taking hydrochloroquine for prophylactic purposes. You signed an executive order saying that doctors here may not prescribe hydrochloroquine for prophylactic purposes. Why are we denying Arizona residents the same rights and privileges being used by the president?
We're not denying Arizonans any rights and privileges with the prescription from a doctor. Of course, Arizonans can access needed pharmaceuticals and health care and medicine. Do you want to talk a little bit about that, Dr. Christ?
Your order very clearly says doctors may not prescribe for prophylactic purposes.
So there's a lot of uses for that medication, and that medication is very important when you're dealing with autoimmune disease or other diseases. And so we want to make sure that the patients that need it, including those that doctors feel that it's appropriate, have access to that medication.
Okay, but you're still defending the order to say doctors may not prescribe this for prophylactic purposes for COVID-19.
So doctors can prescribe it if it is needed by the patient.
For anything other than COVID-19. I'm sure you're quite familiar with your order.
And it can be used if a physician feels that it is necessary. So in COVID-19, not to pre-prescribe it for anybody, but they can use it under certain circumstances.
It's at the discretion of the physician.
Yes.
We'll go to Peter next with PTAR.
Thank you. My next question. So you showed us the unemployment numbers, Governor Ducey. What authority or what kind of pressure would the state be able to exert to get people back to work, especially if they're making more money on unemployment and they can run out the 39 weeks and then go look for a job?
Well, thank you, Peter. Yes, I mean, over 500,000 Arizonans, like I said, these were hardworking people that in most cases have never asked for anything from the government. And 11 weeks ago, they were displaced, out of a job with no income. So that $1.1 billion that's been distributed out over the last several weeks has been that lifeline so that people don't fall through the cracks, they don't lose their apartment or their homes. And this is something that we worked very hard to make certain that it got out, and I know the stresses that were on the system. So I want to say thank you again to the people in state government that have worked overtime to make that happen. We also knew that the economy, when it restarted, would restart in a cautious way. And you can see people coming off the unemployment benefits and going back to work. And we know that Arizonans want to get back to work. We hear that everywhere that we go. We know that employers are reaching out to folks, letting them know the timeline of where this is. Of course, we wanted to have some flexibility, especially for people that may have some kind of underlying health condition. But we want to work to get our economy going again. We want to be responsible and prudent and empathetic, but we want to make certain that we're doing the right thing, and we're going to do that going forward.
So there's no real legal push or ramifications that you could exert as a governor or the state can exert. You're basically we have to depend on people saying, okay, I've sat home enough, I'm ready to go back to work. They have to make this call on their own.
There's thousands and thousands, if not millions, of people that are ready to go back to work right now, and part of it is people ready to go back to work and get after it, and employers that have the capacity, that have the clients and the customer base and the orders that they need the people. And that, over the course of the next several weeks, will continue to ramp up.
Brandon, do you have a question?
Yes, thank you. Let's go back to long-term care homes. It's now 2.5 months into this crisis. It has taken your team about 2.5 months to ramp up an organized effort to test people in a relatively small number of long-term care homes. In the meantime, hundreds of people have lost their lives. Do you, Governor Ducey, and Dr. Christ bear any responsibility for that?
Well, the first thing I want to say, Bram, is your timeline's wrong. Okay? The public health emergency was declared on March 11th. The first executive order that was put forward was to protect long-term care homes. And the testing that was originally surged was to the people that were on the front lines, that were taking care of people inside the long-term care facilities and the hospitals. This is a widespread virus. It is all across our state, all across our country, and in 184 countries across the world. Long-term care facilities were our first priority, they were our top priority, and they remain a priority going forward. Dr. Christ?
So while we're just starting the testing of every single resident and employee at these facilities, public health has been in these facilities working on outbreaks and those types of situations, testing individuals that had contact, testing employees that worked with those patients, and providing infection control recommendations. So we've been in the facilities. What we're doing now is doing broad-based testing of everyone.
The facilities have told us they haven't had the protective equipment to do testing, and they really haven't had much testing. And I stand by my original comment about 2.5 months ago. Again, no organized testing of these facilities has been done, and we've seen these massive outbreaks. So are you in any way responsible for that?
So we've been working with the facilities. There is a national shortage of PPE that has gotten better recently. We still work to get them additional PPE and to get testing, but public health has been assisting these facilities.
Was that a no then?
I'm going to say we have been working very closely with
I'm
these
going to
facilities.
say, in terms of, we mourn every death. Everything we have done has been to reduce the spread of COVID-19 and to reduce the amount of resulting deaths and sicknesses because of it.
It's like that. Can I add on to Peter's question just to clarify something that the governor said? Certainly. So DES's policy is not to provide benefits to people who do not have a COVID-related reason for not taking a job back. Treasury Secretary Steven Mnuchin said yesterday, if you don't take your job back, your benefits should be withdrawn, and your employer should tell your local unemployment insurance agency that you refused a job. Do you recommend that employers tell DES if someone is refusing a job because they'd rather accept jobless benefits?
Well, our first priority is going to be public health. That's why the policy is there and provides flexibility for people that may have a unique situation. And I want employers, of course, they've been cooperative in working with us in terms of the orders that we've put forward. Now they're beginning to ramp up and reopen their businesses, and they're going to use the policies that the state has to make sure that the information's available as they have to hire or rehire workforce.
Should they report to DES whether an employee is refusing a job?
They should contact the employee, find out the situation, and then communicate whatever the information is.
We're going to go to the board next to Zoom. Allison Steinbach from the Arizona Republic. Allison, go ahead.
Hi, thanks for calling on me. I have a question for Dr. Christ. A lot of people are still wondering about recovery numbers, and your department told me that would be added to the dashboard starting on May 4th, but it's still not reported. So when will that number be public, and what's been the holdup?
So we continue to work on developing recovered numbers. You can find numbers that include the recovered on our reported, it's the hospital metrics. If you look at the number of patients discharged from hospitals, we report on that daily. We are also looking at developing another definition, but that has been difficult because one person's definition of recovered, we're kind of looking into a survived metric.
Let's go over here to Vaughn from NBC News.
Governor, thank you. You said at the top...
Welcome home, Vaughn.
Thank you, I appreciate it. You said we're starting to see some positive results. And for folks that are looking sheerly at the numbers, if you could kind of better explain to us what you're seeing in terms of positive results, because if you're looking at the numbers, this last week averaged the most ventilators in use. This last week averaged the most in-beds used for COVID illnesses. And if you look at the last 2 weeks, not counting this week, you essentially had over 2,000 cases each of the last 2 weeks while having the same number of test results. Can you help us better explain?
So, fair question, Vaughn. I would say the Dr. Robert Redfield, Deborah Birx, Anthony Fauci laid out the metrics, the stage gates of the results that you should look for before you make decisions. And if you go back in the deck in terms of the journey I've taken you through in symptoms, cases, hospital capacity, and testing, we're going in the right direction in each of those. So when the idea was that we would have the medical capacity if there were a spike. That's why the surge from the Army Corps of Engineers, the National Guard for potential field hospitals, if necessary, the acquisition around ventilators. This is a widespread virus. We're doing more testing. When you have more testing, you're going to see more cases. But you saw the amount of folks that are in hospital beds have been within 1 or 2% the entire time. Same with ICU beds and ventilator use. So when I talk about the positive results, I'm talking about that our symptoms are going down in terms of people that are contracting it. The number of cases that we're seeing as a percentage of people testing is going down. We have the hospital capacity, ICU, and ventilators, and we're ramping up. We've gone from testing only symptomatic people, doctors, nurses, and emergency medical providers, to people that believe that they have COVID-19 or have been exposed to COVID-19, to expanding that to everyone inside our long-term care facilities and everyone that needs it inside our Department of Corrections. Each one of those are positive results, and the results that you need to make the responsible decisions that we have to take gradual steps to reopen our economy. Of course, we're asking people to continue to wash their hands and physically distance and make responsible decisions, but we can confidently make the decisions that we've made in phase 1 of the White House gating criteria.
What do you need to see 2 weeks from now? What do you want to see 2 weeks from now to be convinced that there is not a second wave as a result of this reopening?
We're going to follow these same metrics. We're going to follow exactly what, this is why I show them. I can see some of the reporters out here rolling their eyes because they've seen them before, but these are the metrics that we look at. These are the metrics that public health has. These are the metrics that have been put forward by the Centers for Disease Control. If they would go in a different direction, that would be a sign of caution, but they're not. We have 5 consecutive weeks going in the right direction. That is a testament to the good common sense behavior of Arizonans across the state. I'm grateful for that. I wish that would be part of the report tonight, Vaughn.
Governor, I have 2 topics, DES and your dimmer switch, if I may. You're in charge. You spent about 2 minutes on DES showing slides with dollars, though. But why is DES not aggressively updating Arizonans daily about what is being done to expedite claims? Why is your director, Tom Betlak, not a part of these press conferences? Why can't we hear from him?
Tom Betlak is among the finest public servants in Arizona state government, if not the finest servant in Arizona government. When he retired last year, we created a Tom Betlak Award, which I said was the equivalent of the Pat Tillman Award for an Arizona State Sun Devil. Tom Betlak's not at these conferences because he's working. He's at the Department of Economic Security. He distributed $777 million along with $1.3 billion in the pandemic insurance. He's doing a great job along with his team under the most difficult of circumstances, so it is not perfect. There have been delays. There have been busy signals. This team is going to be working on Sunday and Monday, Memorial Day of this week, to continue to get the benefits out. And I realize the frustration. I mean, I've read and heard the voicemails. So we want to get these dollars to the people that have them coming. If you can apply online, via the internet, via the DES.gov website, it is much more seamless. And when there's confusion, people are calling in. They are experiencing busy signals. The earlier you can call in the morning, the better. The lines do clog. We've hired hundreds of people, but they're going to be working Sunday and Monday to get people their benefits. But in terms of Tom Betlak and his quality of service and work in Arizona state government, it is unmatched.
Well, there has to be a number two. The problem is lack of communication. People feel that no one cares. They're falling through the systems. What are you going to do to fix communication? And when will you make someone available with reasonable knowledge on DES about the failing system?
Well, our system is not failing. Our system has been stressed, and we are backing the system up. We are investing in the system. We are providing additional servers and computing ability and cloud capacity. And I'm the one who's responsible for what's happening. I told you about the amount of dollars that have been distributed at the state level, over $1.1 billion, and we're fixing the issues. We care about these people. We want them to get their benefits. We've worked very hard to do it. We have hundreds of millions of dollars that are being dispersed on a weekly basis, and we can do more.
Okay, my last question, just my last one on the dimmer switch. It's just a yes or a no. If we see the system become overwhelmed, if we see cases jump, deaths go up, will you turn back your dimmer switch? Just yes or no?
I am going to use every tool available to a governor to do what's in the best interest of public health in Arizona.
Yes or no?
That answers your question, Nicole.
Okay.
Board next. We're going to call on Jeremy Duda from the Arizona Mayor. Jeremy, go ahead.
Hi, Governor. The state has a $5 million renters assistance program to help folks avoid evictions, but out of about 11,000 applications, money's only gone to not quite even 550 people. Why has that been so slow in getting out to renters in Arizona, and does that program need more funding for renters?
Jeremy, thanks for the question. I don't know the answer. Let me find out, do some homework on that. Those dollars are available. Part of the reason we put forward a number of the executive orders was we didn't want to see people lose their apartment or lose their homes. I want to thank the banks and the landlords who have been, the owners who have been so cooperative in doing this. Through the downturn, of course, we've got the assistance fund along with unemployment insurance and the pandemic insurance as well to make sure people don't fall through the cracks. I need to do a little homework on that and get back to you.
Let's go right here, please. Yes.
Governor, I'm from KOLB in Tucson. Speaking of Tucson, what's your response to local governments like Pima County that are putting regulations into place that go beyond what you have?
Well, what I'd say to all of our elected leaders throughout the state, I want to thank them for their partnership, their help, and support. In Arizona, we've had our fair share of challenges, and we've tried to deal with them with a real sense of urgency. We have been fortunate from the perspective that what we've seen in other places like in New York State, which was hit first and hit hardest, has not happened in Arizona. So the guidance that the CDC and White House has given the state of Arizona was that we could go county by county or statewide. The guidance that we have put out is statewide, and that's what we expect municipalities to follow. Those are the guidelines.
Antonia and then Matt.
Governor, are you offering any resources for undocumented people?
We're making sure that anyone that needs comfort or care from a medical perspective will have that.
There's other states across the country that have announced support through COVID-19 relief funds to support undocumented people. Do you know if maybe the $8.9 million COVID-19 fund that you spoke about earlier offers any kind of help for our families here?
The resources that we put forward in Arizona are to our citizens who have been on unemployment. I'm not certain exactly what the CARES Act specifies, but we're applying the dollars where they're appropriated to go.
What can we rely to our viewers who don't qualify for state benefits but are looking for some sort of a relief because of this situation?
Our focus is going to be from a first and foremost standpoint is protection on public health, and we wanted to make sure that anyone that needed it could have care and comfort. That'll continue.
Thank you. Dr. Chris, I think it would be best for her. I'm just trying to get an update as well on St. Luke's Hospital, what the latest is with that project.
So the Army Corps of Engineers is finishing up a couple of projects. So they had initially had it ready to be turned over May 2nd. There were some punch list items, things like painting, other projects. They are finishing that up, and they are scheduled to be finished on June 1st. And so at that point, it will become a warm alternate care site. So not operating, but ready to be stood up when and if we need it in Arizona.
And I just want to add on to that, thank you to the Army Corps of Engineers. When and if we need it. St. Luke's is not needed today. Existing hospital capacity has availability today. That's a field hospital. If there were to be a surge, there's zero evidence of that on the horizon today.
It ends up that it doesn't get used. Do you guys know what ends up happening? Does it just go to where its status was beforehand?
Yes, so that it would just go back. The improvements would obviously remain, and then it would go back to the status that it was current, or it was in before we engaged with them.
Matt?
I have a question about percent positive tests. On your slide, it had a 3%, but on the ACDHS website today has a 5.8%, which would go back further in your numbers. What's the reason for that discrepancy?
So that data was pulled for the slideshow last night, and so that does get updated every day. And so that last slide, the last one, will continue to add numbers to it because that's the current week we're in, and so a lot of that testing is going to be reflected on a daily basis. That's just a daily data upload.
Dennis?
Yeah, Governor, I was just curious whether or not you agree with the legislature right now that is moving forward with legislation to protect businesses from liability that would be forcing workers to go back to work and they may not have the proper PPE. Is that in the best interest of the state?
Well, like I've said, we want to protect public health. We want to reinvigorate our economy. We want to make sure that workers are protected. I want to say we hear from thousands of people that want to get back to work. There may not be that job available for them today, but it's coming. We know the economy is changing. I know there's been some concerns that have been expressed in the legislature and out of Washington, D.C. What we're focused on in the governor's office is protecting public health and reinvigorating the economy. That's where our priorities are.
But should they be required to provide that PPE to their workers if they return? There are plenty of workers out there.
It really depends on the situation. We expect employers to be responsible. Of course, in a setting like this, you have employers that want to hire people. You have people that want to go back to work. That can be part of that discussion.
So no requirement then?
We're not going to require things from the state level. We expect employers and employees to be responsible, and they have been, and I'm grateful.
As far as we know, bars are still supposed to be closed, not serving alcohol. That part of the ordinance hasn't changed. What about these renegade bars that may be serving alcohol? What's going on with that? What's the state response to that?
Well, I want to say in phase one, dine-in can open. In Arizona, there's some crossover, of course, between dine-in and I don't like to use individual establishments, but if you think like a Zips sports bar or cold beers and cheeseburgers, it might be licensed under a bar, but these are very much dine-in places. So what we're asking for is responsible behavior, physical distancing. We are on a trajectory to head into phase two, which would answer that question. That's not where we are today.
So who handles enforcement? Is it back to the local municipalities?
It's the local municipalities.
Governor, you've said that professional sports will happen in Arizona moving forward.
Professional sports are welcome in the state of Arizona.
Okay.
I wish I had the power to decree that they will happen, Billy.
Should Cardinal fans, is there any chance that the fans will be in the stadium September 20th for the home opener? Have you talked to the NFL, Commissioner Goodell? Where do we sit as sports fans right now in the state of Arizona?
Well, we sit very excited to see the Cardinals kick off, and I want to clarify, dominate the NFC West. I think we can be aspirational on this. There's going to be so much more we know in the next several weeks. If you look at the Opening Up America Again document, if you just search those words on your browser, you'll see the same information that every governor is working off of. So I'm hopeful, but that will be more a decision if not only Arizona, but other states are within that gating criteria. I have heard anecdotally that the NFL does intend to play in the fall. Now, whether or not there are fans in the seats, that's something I'm hopeful for. Great relationship with the Arizona Cardinals, Michael Bidwell, the Bidwell family. So we welcome the NFL and football season to Arizona. We're weeks away from that. In the interim, I'd love to see a baseball season, World Series crowned, an NBA champion, and a Stanley Cup presented. All those are opportunities today without fans.
Thank you.
Real quick from Howie, go ahead. Just want to follow.
Really quickly on Dennis's question here, Governor. Why businesses operate under a set of laws about liability and everything else. I listened to your conversation with business people, including the phone call you did. Why should we allow businesses to escape standard liability because of COVID-19? Why should we have a whole different standard? And why should we have additional liability protections for business?
So, Howie, thanks for the question. I don't know that I've made the case beyond that. I want businesses to be responsible and employees to be responsible, and I want to begin gradually reopening our economy and doing it in a safe and successful way. And I have asked our business owners and leaders to take on that responsibility in doing that. That's what I'm advocating for. It sounds like you need to talk to other folks in other elected positions to talk about what they're advocating for. I've been pretty transparent on what's important to me today.
So you're not advocating for changing the liability standards?
I've talked about what's important to me today. I'm in discussions, of course, with legislative leadership, and I'm open-minded if there's ideas or legislation. I don't want to say that the governor's office and certainly the federal government doesn't have all of the answers, but today, with what we know, with where we are in terms of phase one, we can proceed, and let's proceed with caution.
We're going to wrap it up here. One more from an outlet that hasn't had a chance yet. We'll go to Dylan Rosenblatt from the Capital Times. Dylan, go ahead. Dylan, you're on. You may have to unmute. There you go.
So you were talking about Tom Betlak earlier, who you hired with only to work for 75 days. That 75-day limit is coming up in a couple of weeks. Have you decided if you're going to extend his contract, or have you started making any headway to hire a full-time DES director?
Thank you, Dylan. And we would be happy to extend Director Betlak's contract should he like to renew. He's been pretty straight up with us that he had 75 days in which to help us and fix that agency and make it stronger. So we are going to have some options regardless of what happens. But Tom Betlak is always welcome to come and serve in state government while I am governor. In closing, I want to say thanks to the good people of Arizona. Like I said, if you're looking for a headline here, it would be that Arizona's plan is working. We're going to continue to proceed with caution. We're going to update you on what's happening. You're going to see these metrics and numbers and know where we are on the White House gating criteria in alignment with Centers for Disease Control. I want to thank Dr. Kara Christ and General Mick McGuire and the good people of Arizona. The results that you're seeing today, the direction that we're in as a state, when you see our symptoms going down and our cases in terms of percentage positive being reduced and our hospital capacity, that's because of the responsible behavior you had both before and after the stay-at-home order. We're going in the right direction. Let's keep going in that direction. Thanks very much. We'll see you all soon.